Course Introduction and Objectives. Welcome to the Diploma in Non-Surgical Butt Lift Vacuum Suction. This course is designed to equip you with the theoretical knowledge and practical understanding necessary to perform this popular aesthetic treatment safely and effectively. We will explore the science behind vacuum suction, its benefits, and how to integrate it into your practice. Understanding the foundational principles is crucial for achieving optimal client outcomes and maintaining professional standards within the beauty and wellness industry. This diploma will elevate your expertise in non-invasive body contouring. Upon completion, you will be able to confidently assess clients, select appropriate treatment parameters, and execute the vacuum suction butt lift technique with precision. You will also learn about client care, potential contraindications, and ethical considerations. The objective is to empower you with a holistic understanding, enabling you to deliver exceptional service and build a reputable practice in non-surgical body enhancement. Mastery of these techniques will set you apart in a competitive market. Understanding non-surgical butt lift. Non-surgical butt lift treatments offer an alternative to invasive surgical procedures for individuals seeking to enhance the appearance of their gluteal area. These methods typically involve technologies that stimulate the body's natural processes, such as collagen production, lymphatic drainage, and muscle toning. The primary goal is to achieve a lifted, firmer, and more contoured look without the risks, downtime, or recovery associated with surgery. This approach appeals to a broad client base seeking subtle yet noticeable improvements. Vacuum suction therapy, a key component of this course, utilizes controlled negative pressure to manipulate tissue. This technique is designed to improve blood circulation, stimulate lymphatic flow, and encourage the mobilization of fat cells, contributing to a smoother and more toned appearance. It also helps in breaking down cellulite and promoting skin elasticity. The non-invasive nature and customizable treatment parameters make it a versatile option for various body types and aesthetic goals. Benefits of vacuum suction therapy. Vacuum suction therapy offers a multitude of benefits for non-surgical butt lift and overall body contouring. It significantly improves local blood circulation, which in turn enhances nutrient delivery to skin cells and aids in waste removal. This increased circulation contributes to healthier, more vibrant skin. Furthermore, the mechanical action of vacuum suction stimulates the lymphatic system, facilitating the drainage of toxins and excess fluid, which can reduce puffiness and improve skin texture. These physiological responses are key to its efficacy. Beyond circulation and lymphatic drainage, vacuum suction is renowned for its ability to stimulate collagen and elastin production. These essential proteins are responsible for skin firmness and elasticity, leading to a more youthful and toned appearance. Regular treatments can also help to break down stubborn fat deposits and reduce the appearance of cellulite, creating a smoother and more sculpted silhouette. Clients often report a noticeable lift and improved contour in the treated areas, along with enhanced skin quality. Client consultation and assessment. A thorough client consultation and assessment are paramount before initiating any non-surgical butt lift treatment. This initial phase involves gathering comprehensive medical history, including any pre-existing conditions, allergies, medications, and previous aesthetic procedures. It is essential to identify any contraindications that might preclude the client from treatment or require modifications. Open and honest communication during this stage builds trust and ensures client safety. A detailed discussion of expectations is also critical. Physical assessment includes evaluating the client's skin quality, elasticity, fat distribution, and overall gluteal shape. Taking clear before and after photographs with client consent is crucial for tracking progress and demonstrating results. During the consultation, clearly explain the treatment process, potential outcomes, expected number of sessions, and aftercare instructions. Manage expectations realistically. emphasizing that results vary per individual and are gradual. This meticulous approach ensures a tailored and safe treatment plan. Anatomy of the gluteal region. A comprehensive understanding of the anatomy of the gluteal region is fundamental for performing non-surgical butt lift procedures effectively and safely. The gluteal region is primarily composed of three major muscles: the gluteus maximus, gluteus medius, and gluteus minimus. The gluteus maximus is the largest and most superficial, responsible for the overall shape and projection of the buttocks. The gluteus medius and minimus lie beneath, contributing to hip abduction and stabilization. Knowledge of these muscles guides proper cut placement and technique. Beyond the muscles, the gluteal region also comprises significant layers of subcutaneous fat, connective tissue, and skin. The distribution and density of this fat layer greatly influence the buttocks' contour and firmness. A network of nerves and blood vessels also traverses this area, requiring careful consideration during treatment to avoid injury. Understanding the interplay between these structures allows practitioners to target specific areas for enhancement and ensure client comfort and safety throughout the procedure. This anatomical knowledge is the bedrock of effective treatment. Skin and subcutaneous tissue structure. The skin, the body's largest organ, forms the outermost layer of the gluteal region and plays a crucial role in its appearance and health. It consists of the epidermis, dermis, and hypodermis. The epidermis provides protection, while the dermis, rich in collagen and elastin, gives skin its strength and elasticity. The hypodermis, or subcutaneous tissue, is primarily composed of fat cells, adipocytes, and loose connective tissue. This layer is critical for insulation, energy storage, and contributing to the overall contour of the buttocks. Understanding these layers is vital for vacuum suction efficacy. The subcutaneous tissue structure varies among individuals and influences how vacuum suction therapy interacts with the body. Cellulite, a common concern, manifests as dimpling on the skin's surface due to fat cells pushing against connective tissue. Vacuum suction aims to improve the appearance of cellulite by enhancing circulation, promoting lymphatic drainage, and potentially breaking down fibrous bands. The treatment also stimulates fibroblasts in the dermis, leading to increased production of collagen and elastin, which improves skin texture and firmness. This multi-layered approach targets various aesthetic concerns. Lymphatic system overview. The lymphatic system is a crucial part of the immune system and plays a vital role in fluid balance and waste removal throughout the body. It consists of a network of vessels, nodes, and organs that transport lymph, a fluid containing white blood cells, throughout the body. Unlike the circulatory system, the lymphatic system does not have a central pump. Instead, it relies on muscle contractions and external pressure to move lymph. Understanding its function is essential for maximizing the benefits of vacuum suction therapy. In the context of non-surgical butt lift, stimulating the lymphatic system through vacuum suction helps to reduce fluid retention and eliminate metabolic waste products and toxins from the treated area. This process can significantly decrease puffiness and contribute to a smoother, less congested appearance of the skin. Enhanced lymphatic drainage also supports the body's natural detoxification processes, improving overall tissue health and responsiveness to treatment. Proper technique ensures effective lymphatic stimulation without causing damage. Circulatory system relevance. The circulatory system, comprising the heart, blood vessels, and blood, is responsible for transporting oxygen, nutrients, hormones, and waste products throughout the body. In the gluteal region, a dense network of arteries, veins, and capillaries supplies blood to the muscles, skin, and fat tissues. Efficient blood flow is crucial for cellular health, tissue repair, and the overall vitality of the skin. Vacuum suction therapy directly impacts this system, making its understanding critical. Vacuum suction enhances local blood circulation by creating negative pressure, which draws blood to the surface and dilates capillaries. This increased blood flow delivers a richer supply of oxygen and nutrients to the treated tissues, promoting cellular regeneration and improving skin health. It also aids in the removal of metabolic byproducts, contributing to a healthier tissue environment. Improved circulation can lead to a more even skin tone, reduced inflammation, and a more vibrant appearance, all contributing to the aesthetic goals of a butt lift. This systemic effect is a cornerstone of the treatment's benefits. How vacuum suction works. Vacuum suction therapy operates on the principle of controlled negative pressure. A specialized machine creates a vacuum inside cups placed on the skin, gently lifting the tissue into the cup. This suction action pulls the skin, subcutaneous fat, and underlying muscles upwards, creating a temporary expansion of the treated area. The intensity and duration of the suction are carefully controlled by the practitioner to ensure client comfort and optimal therapeutic effect. This mechanical manipulation is the core of the treatment. The negative pressure generated by the vacuum suction has several physiological effects. It enhances blood circulation by drawing blood to the surface and dilating capillaries, increasing oxygen and nutrient supply to the cells. Simultaneously, it stimulates the lymphatic system, promoting the drainage of accumulated fluids and toxins. The mechanical stretch on the connective tissues and fat cells also encourages their mobilization and can help break down fibrous bands associated with cellulite. This multifaceted action contributes to the lifting, firming, and contouring results observed. Effects on skin and muscle tissue. Vacuum suction therapy exerts significant effects on both skin and muscle tissue, contributing to the overall butt lift and contouring results. On the skin, the mechanical stretching and increased blood flow stimulate fibroblasts, leading to enhanced production of collagen and elastin. These proteins are crucial for maintaining skin firmness, elasticity, and a youthful appearance. The improved cellular activity also contributes to a smoother skin texture and a reduction in the appearance of fine lines and wrinkles in the treated area. This rejuvenation is a key benefit. For muscle tissue, while vacuum suction is not a direct muscle builder, the deep tissue massage effect can improve muscle tone and definition. The increased blood flow to the muscles aids in oxygenation and nutrient delivery, which can support muscle recovery and overall health. Furthermore, the manipulation of the superficial fascia and connective tissues surrounding the muscles can help release tension and improve flexibility. This indirect effect on muscle tissue, combined with skin tightening, creates a more lifted and sculpted appearance, enhancing the natural contours of the gluteal region. Lymphatic drainage and detoxification. One of the most significant benefits of vacuum suction therapy is its profound effect on lymphatic drainage. The negative pressure created by the suction cups gently pulls and releases the skin, effectively massaging the lymphatic vessels. This mechanical action stimulates the flow of lymph, which carries metabolic waste products, toxins, and excess interstitial fluid away from the treated area. Efficient lymphatic drainage is crucial for reducing swelling, puffiness, and the appearance of cellulite. It promotes a healthier, less congested tissue environment. By enhancing lymphatic circulation, vacuum suction therapy supports the body's natural detoxification processes. The removal of accumulated waste products and toxins contributes to improved skin clarity and overall tissue health. Clients often experience a feeling of lightness and reduced water retention in the treated areas. This detoxification aspect not only contributes to aesthetic improvements, but also supports general well-being. Regular and consistent lymphatic stimulation is key to maintaining these benefits and achieving long-term results in body contouring. Collagen and elastin stimulation. The mechanical action of vacuum suction therapy plays a crucial role in stimulating the production of collagen and elastin, two vital proteins for skin health and appearance. The gentle stretching and manipulation of the skin and subcutaneous tissue by the suction cups trigger a natural healing response within the dermis. This response involves the activation of fibroblasts, the cells responsible for synthesizing new collagen and elastin fibers. Increased production of these proteins leads to significant improvements in skin firmness and elasticity. As new collagen and elastin fibers are generated, the skin becomes denser, smoother, and more resilient. This process helps to tighten loose skin, reduce the appearance of wrinkles, and improve overall skin texture in the gluteal area. The enhanced structural integrity of the skin contributes directly to the lifting and contouring effects of the non-surgical butt lift. Consistent treatments encourage ongoing collagen remodeling, leading to progressive and long-lasting results. This cellular regeneration is fundamental to achieving a youthful and toned aesthetic. Types of vacuum suction machines. The market offers a variety of vacuum suction machines designed for aesthetic treatments, each with different features and capabilities. These machines typically range from portable, tabletop devices suitable for smaller practices to larger, more advanced systems with multiple functions and customizable settings. Key considerations when choosing a machine include its suction power, pulsation capabilities, and the range of available cups and applicators. Understanding these variations is essential for selecting the right equipment for your practice and client needs. Advanced vacuum suction machines may offer features such as adjustable suction intensity, continuous or pulsed suction modes, and integrated radiofrequency or LED light therapy. Pulsed suction can be particularly effective for lymphatic drainage and stimulating circulation, while continuous suction is often used for deeper tissue manipulation. Familiarity with different machine types allows practitioners to optimize treatment protocols and achieve superior results. Always ensure the chosen equipment is certified, safe, and meets industry standards for professional use. Cups and applicators selection. The selection of appropriate cups and applicators is critical for effective and comfortable vacuum suction treatments. Cups come in various sizes and shapes, each designed for specific areas and treatment goals. Larger, rounded cups are typically used for general buttock contouring and lymphatic drainage, covering broader areas. Smaller, more targeted cups may be employed for specific areas of cellulite reduction or for lifting and shaping particular curves. Material, usually transparent acrylic or silicone, also varies. Beyond size and shape, some applicators feature rollers or internal textures that enhance the massage effect and further stimulate circulation and lymphatic flow. Silicone cups offer more flexibility and a softer touch, while acrylic cups provide firmer suction and are often preferred for deeper tissue manipulation. Understanding the nuances of each cup type allows practitioners to customize treatments, ensuring optimal contact with the skin and maximizing therapeutic benefits. Proper maintenance and sterilization of all applicators are also paramount for hygiene and client safety. Essential topical products. The use of essential topical products before, during, and after vacuum suction therapy significantly enhances treatment efficacy and client comfort. Before treatment, a cleansing solution is used to prepare the skin, ensuring it is free of oils, lotions, and impurities. This step is crucial for optimal cup adhesion and hygiene. During the procedure, a high-quality massage oil or gel is applied to the skin. This lubricant allows the cups to glide smoothly, preventing friction and irritation while facilitating the vacuum's action. The choice of lubricant can also offer additional benefits. Post-treatment, soothing and hydrating lotions or creams are recommended to calm the skin, reduce any temporary redness, and lock in moisture. Products containing ingredients like aloe vera, hyaluronic acid, or arnica can aid in recovery and enhance skin regeneration. Some practitioners also incorporate firming creams with active ingredients like caffeine or peptides to further support the contouring and tightening effects. Always select professional-grade products that are non-comedogenic and suitable for sensitive skin, ensuring client safety and maximizing results. Proper product selection is integral to a successful treatment protocol. Hygiene and sterilization protocols. Maintaining strict hygiene and sterilization protocols is non-negotiable in any aesthetic practice, especially when performing vacuum suction therapy. All equipment that comes into contact with the client's skin, including cups and applicators, must be thoroughly cleaned and disinfected after each use. Disposable items such as gloves and bed sheets should be used once and discarded properly. This rigorous approach prevents the spread of bacteria, viruses, and fungi, safeguarding both the client and the practitioner. Adherence to these standards is a professional imperative. The cleaning process typically involves rinsing cups to remove any product residue, followed by washing with an antibacterial soap and water. Subsequently, they should be immersed in a hospital-grade disinfectant solution for the recommended contact time or sterilized using an appropriate method. Work surfaces, treatment beds, and any reusable tools must also be cleaned and disinfected between clients. Practitioners must always wear gloves during treatment and maintain excellent personal hygiene. Implementing and consistently following these protocols ensures a safe, sanitary, and professional treatment environment, building client confidence and trust. Pre-treatment preparation. Thorough pre-treatment preparation is essential for ensuring a safe, effective, and comfortable vacuum suction butt lift session. This begins with a final review of the client's consultation form and medical history to confirm no new contraindications have arisen. The client should be advised to hydrate well before the appointment and avoid heavy meals. The treatment area must be cleansed thoroughly to remove any lotions, oils, or debris, ensuring optimal cup adhesion and hygiene. This step is critical for successful treatment. Prepare all necessary equipment and products, including the vacuum suction machine, selected cups, massage oil or gel, and any post-treatment lotions. Ensure the treatment room is clean, comfortable, and at an appropriate temperature. Position the client comfortably on the treatment bed, ensuring privacy and ease of access to the gluteal area. Explain the procedure one last time, addressing any lingering questions or concerns the client may have. This meticulous preparation minimizes risks and maximizes client satisfaction, setting the stage for a successful treatment outcome. Step-by-step vacuum suction application. The application of vacuum suction therapy for a butt lift follows a structured, step-by-step protocol to ensure safety and effectiveness. After skin preparation and lubrication, select the appropriate size and shape of vacuum cups. Begin by placing the cups firmly on the gluteal area, ensuring a complete seal. Activate the vacuum suction machine, gradually increasing the intensity to the client's comfort level, observing skin response. The goal is to achieve a gentle lift of the tissue into the cup without causing discomfort or excessive redness. This initial placement is crucial. Once suction is established, the cups can be either left stationary for a few minutes to promote localized circulation and lymphatic drainage, or they can be moved in specific gliding motions. For butt lifting, upward and outward strokes are commonly used to sculpt and elevate the gluteal muscles and surrounding tissues. The duration of each suction application and the overall treatment time will vary based on the client's individual needs and the desired outcome. Maintain constant communication with the client to monitor their comfort. After the treatment, gently release the suction and remove the cups, then apply a soothing post-treatment product. Specific techniques for buttocks shaping. Achieving optimal buttocks shaping with vacuum suction requires specific techniques tailored to individual client needs and desired outcomes. For a general lift and volume enhancement, larger cups are typically applied to the lower and outer gluteal areas, with suction directed upwards. This helps to create a more rounded and elevated appearance. For clients seeking to reduce the appearance of hip dips, smaller cups can be strategically placed along the lateral gluteal region, to encourage fat mobilization and contouring. Precision in cup placement is paramount. To address cellulite, a combination of stationary and gliding techniques can be employed. Stationary cups can be left on areas with concentrated cellulite to stimulate circulation and lymphatic drainage, while gliding motions help to break down fibrous bands and smooth the skin. For a more defined contour, practitioners may use a combination of continuous and pulsed suction modes, adjusting intensity based on tissue response. The art of buttocks shaping lies in understanding the gluteal anatomy and applying varied techniques to sculpt and refine the area, creating a harmonious and aesthetically pleasing result. Continuous practice and observation are key to mastering these techniques. Combining with other modalities. While vacuum suction therapy is highly effective on its own, combining it with other aesthetic modalities can significantly enhance results and address a wider range of client concerns. For instance, combining vacuum suction with radiofrequency (RF) therapy can provide superior skin tightening benefits. RF energy heats the deeper layers of the dermis, stimulating collagen production and remodeling, which complements the lifting and contouring effects of vacuum suction. This synergistic approach often yields more dramatic and long-lasting outcomes. Understanding these combinations expands your service offerings. Another beneficial combination involves integrating vacuum suction with cavitation or cryolipolysis for enhanced fat reduction. Cavitation uses ultrasound waves to break down fat cells, while cryolipolysis freezes them. Following these treatments with vacuum suction can help to mobilize the released fat and improve lymphatic drainage, accelerating the body's natural elimination process. However, it is crucial to understand the specific protocols and safety considerations for each combined modality. Proper training in each technique is essential before offering integrative treatments to clients, ensuring both efficacy and safety. Post-treatment instructions. Providing clear and comprehensive post-treatment instructions is vital for client safety, comfort, and optimizing the results of a non-surgical butt lift with vacuum suction. Clients should be advised to stay well hydrated by drinking plenty of water, as this supports lymphatic drainage and the elimination of toxins. Avoiding hot baths, saunas, and strenuous exercise for at least 24 to 48 hours post-treatment is generally recommended to prevent excessive swelling or irritation. Gentle massage of the treated area can also be beneficial. Clients should also be instructed to wear loose, comfortable clothing to avoid friction or pressure on the treated area. Applying a soothing, hydrating lotion or cream, as recommended by the practitioner, can help calm the skin and aid in recovery. It is important to inform clients about potential temporary side effects, such as mild redness, bruising, or tenderness, and advise them on when to contact the clinic if concerns arise. Emphasize the importance of following the recommended treatment schedule for progressive and lasting results. Clear communication ensures client compliance and satisfaction. Managing client expectations effectively. Managing client expectations is a cornerstone of professional practice in non-surgical aesthetics. It is crucial to have an honest and transparent discussion during the initial consultation about what vacuum suction therapy can realistically achieve. Emphasize that results are typically gradual and cumulative, requiring a series of treatments rather than a single session. Avoid promising dramatic, surgical-level transformations, as this can lead to client dissatisfaction. Focus on achievable improvements in contour, firmness, and skin texture. Realistic expectations foster trust. Explain that individual results can vary based on factors such as metabolism, lifestyle, age, and initial body composition. Provide examples of typical outcomes through before and after photos, with consent, highlighting the subtle yet significant enhancements. Reinforce the importance of adhering to post-treatment care and maintaining a healthy lifestyle to support and prolong the results. By setting clear, realistic expectations from the outset, Practitioners can ensure client satisfaction and build a positive long-term relationship, fostering repeat business and referrals. Potential side effects and contraindications. While non-surgical butt lift vacuum suction is generally safe, practitioners must be aware of potential side effects and absolute contraindications. Common temporary side effects include mild redness, tenderness, and slight bruising in the treated area, which typically resolve within a few days. Less common but possible side effects include temporary numbness or tingling. Educating clients about these possibilities during the consultation is crucial for managing their expectations and ensuring their comfort. Proper technique minimizes these occurrences. Absolute contraindications for vacuum suction therapy include pregnancy or breastfeeding, active skin infections, open wounds, or severe acne in the treatment area, recent surgery in the gluteal region, certain circulatory disorders or blood clotting issues, severe varicose veins, cancer or undergoing cancer treatment, uncontrolled diabetes, use of blood-thinning medications, relative contraindication, requires medical clearance. Always conduct a thorough medical history review and obtain client consent. If any contraindications are present, the treatment should be postponed or avoided, and medical advice sought if necessary. Prioritizing client safety is paramount. Recommended treatment plans and frequency. Establishing an effective treatment plan and frequency is crucial for achieving optimal and lasting results with non-surgical butt lift vacuum suction. Most clients require a series of initial treatments, typically ranging from 6 to 12 sessions, performed 1 to 2 times per week. The exact number and frequency depend on the client's individual goals, current body composition, and how their body responds to the therapy. A thorough initial assessment helps determine the most appropriate plan. Consistency is key during this initial phase. Following the initial series, maintenance sessions are highly recommended to sustain the achieved results. These can be scheduled monthly or every few months, depending on the client's preference and the longevity of their results. Educate clients that vacuum suction therapy is not a one-time fix, but rather a commitment to ongoing body contouring and skin health. Combining treatments with a healthy diet, regular exercise, and proper hydration will significantly enhance and prolong the benefits. Tailoring the plan to each client ensures personalized care and maximizes satisfaction. Pricing and marketing strategies. Developing effective pricing and marketing strategies is essential for the success of your non-surgical butt lift vacuum suction services. When determining pricing, consider factors such as your operational costs, machine investment, product expenses, your expertise, and local market rates. Offer package deals for a series of treatments, as this encourages client commitment and provides better value. Clearly communicate the value and benefits of the treatment to justify your pricing. A well-structured pricing model is crucial for profitability. For marketing, utilize a multi-channel approach. Create a professional website and active social media presence, showcasing before and after photos, with consent, and client testimonials. Offer introductory promotions or loyalty programs to attract new clients and retain existing ones. Collaborate with local fitness centers, spas, or wellness influencers. Host informational events or workshops to educate potential clients about the benefits. Highlight the non-invasive nature, lack of downtime, and natural-looking results. Emphasize safety, professionalism, and the unique benefits your services provide. Consistent marketing efforts will build your brand and client base. Legal and ethical considerations. Operating within the legal and ethical framework is paramount for any aesthetic practitioner offering non-surgical butt lift vacuum suction. Ensure you are fully licensed and insured to perform these treatments in your specific region or country. Adhere to all local health and safety regulations, including those pertaining to hygiene, waste disposal, and client privacy. Maintain accurate and confidential client records, including consultation forms, medical history, consent forms, and treatment notes. Compliance with these regulations protects both your practice and your clients. Ethical considerations involve always acting in the best interest of your client. This includes providing honest and realistic information about treatment outcomes, avoiding overselling or making false promises, and respecting client autonomy. Never pressure a client into a treatment. Ensure informed consent is obtained, meaning the client fully understands the procedure, its benefits, risks, and alternatives. Continual professional development and staying updated on best practices and regulations are also ethical responsibilities. Upholding high ethical standards builds a reputable and trustworthy practice.